Imagine a helpless newborn gasping for air due to a vicious virus that's currently surging through the United States. That's the alarming truth behind the rising tide of respiratory syncytial virus, RSV cases, that's putting countless infants in danger. But here's where it gets really concerning. This isn't just a minor cold. It's a highly contagious threat that's sending more babies and toddlers to the hospital than ever before, especially as we enter the peak of the fall and winter respiratory season, filled with other illnesses like COVID-19 and the flu. And this is the part most people miss. RSV poses an especially grave risk to the tiniest tots, which is why health professionals are urging pregnant women to get vaccinated right before delivery or ensure their newborns receive protection as soon as possible. This is the ideal moment to receive your RSV vaccine if you haven't already, advised the Los Angeles County Department of Public Health in a recent statement. So what exactly is RSV and how does it spread? Think of it as a sneaky respiratory bug that can leap from person to person through simple actions like coughing or sneezing. But it doesn't stop there. It can also hitch a ride on contaminated surfaces, such as a doorknob, and then transfer to you if you touch your face without washing your hands first. For beginners, RSV stands for Respiratory Syncytial Virus, and it targets the respiratory system, causing symptoms that might start like a common cold, but can quickly escalate.
Recent data paints a stark picture.
In the week ending October 11th, roughly 1.2% of emergency room visits for infants under 1 year were tied to RSV, jumping from just 0.4% the previous month, as reported by Pop Hive, an initiative from Yale School of Public Health. An RSV surge is clearly building momentum, noted epidemiologists Caitlin Jedalina and Hannah Toddy in their blog, Your Local Epidemiologist. Why is this virus so perilous, particularly for the youngest? According to the U.S. Centers for Disease Control and Prevention, CDC, RSV can be life-threatening not just for babies, but also for older adults and those with underlying health issues. It often leads to serious complications like pneumonia, an infection that inflames the lungs, or bronchiolitis, which is a severe swelling of the tiny airways in the lungs, as explained by the California Department of Public Health.
To put it simply, bronchiolitis is like a clogging of the lungs' smaller tubes,
making breathing incredibly difficult. On average, about 2% to 3% of young infants end up hospitalized for RSV each year, per CDC statistics. And shockingly, most of these children were otherwise healthy before complications arose, based on a study in the journal Pediatrics. Hospitalized kids might need extra oxygen, IV fluids, or even a ventilator to support their breathing. Treatments that highlight just how severe this can get. Unlike the flu or COVID-19, there's no antiviral medication to cure RSV once you're infected, underscoring the importance of prevention. As of now, the overall respiratory illness activity from RSV, flu, and COVID-19 remains very low in California, according to state health officials.
Yet, we're witnessing the early signs of the respiratory virus season kicking in,
warned the LA County Department of Public Health. In Santa Clara County, the most populated area in Northern California, officials are already detecting medium levels of RSV in wastewater samples from places like San Jose, Palo Alto, and Sunnyvale. Dr. Regina Chinzio Kwong, Orange County's health officer, stresses that now is the perfect time to vaccinate if you haven't, particularly before respiratory virus activity might ramp up later on. Who should get these RSV vaccines? Recommendations include pregnant women between 32 and 36 weeks of pregnancy. That's roughly 1 to 2 months before their due date, as well as anyone 75 and older, and those aged 50 to 74, with conditions like diabetes, cancer, kidney problems, weakened immunity, asthma, or heart disease.
It's also advised for residents of nursing homes or long-term care facilities.
If a mom didn't get the shot during pregnancy, health experts suggest vaccinating the infant instead. RSV vaccines are relatively new, rolling out in 2023, and there are 3 options: Moderna's mRESVIA, Pfizer's Abrysvo, and GSK's Arexvy. All protect older adults, but only Pfizer's is approved for expectant mothers. For babies, immunization began that same year
with monoclonal antibodies. Not true vaccines, but they work similarly by boosting protection against the virus. Interestingly, seniors who have already been vaccinated for RSV typically don't need a booster. These vaccines came after a grueling 2022-23 season, when California faced an overwhelming triple-demic of RSV, flu, and COVID that overwhelmed hospitals. Unlike RSV shots, flu and COVID vaccines are usually advised annually or more frequently before each respiratory season. For instance, older adults aged 65 and up can receive COVID shots every 6 months, as per the California Department of Public Health. And good news, you can get RSV, flu, and COVID vaccinations all in one healthcare visit, as Dr. Chincio Kwong points out. Getting all eligible vaccines at the same time is the best approach, helping to avoid scheduling hassles that might lead to missed doses, she explains. Flu shots are recommended yearly for anyone 6 months and older, while COVID vaccines are open to anyone who wants them. The California Department of Public Health specifically encourages them for those 65 and up, infants from 6 months to 23 months, unvaccinated kids and teens, people with certain health risks, and their close contacts. Pregnant women are also urged to get the COVID shot. Despite early worries this season about accessibility, pharmacists and officials now confirm that securing COVID vaccines is straightforward. But here's where it gets controversial. The rollout wasn't without drama. Back in late summer, confusion arose due to mixed guidance from agencies under Health and Human Services Secretary Robert F. Kennedy Jr., a known critic of vaccines. The Food and Drug Administration, FDA, initially approved COVID-19 vaccines only for those 65 and older, or younger people with health issues, and an unusual delay by the CDC in issuing broader recommendations caused chaos. In some states, this meant pharmacies turned away seniors and others, even during a late summer spike, and at one point, the CDC's Advisory Committee on Immunization Practices almost pushed for COVID vaccines to be prescription only. On October 6, acting CDC Director Jim O'Neill removed the recommendation for adults under 65 to get the updated COVID-19 vaccine, shifting to a model of individual decision-making with a doctor's advice. Now individuals can walk into a pharmacy and discuss the option with a professional, said Allison Hill from the American Pharmacists Association during a webinar. California has also updated its laws to allow pharmacists to administer COVID shots independently, as noted by Dr. Erica Pan of the State Department of Public Health. This shift raises questions. Should vaccine policies be more straightforward and consistent to avoid such disruptions? Is the move toward personalized decisions empowering or potentially risky? And what about RSV? Are we doing enough to protect our most vulnerable? Do you agree with the current vaccination guidelines, or do you see room for improvement? Share your opinions in the comments. We'd love to hear your take.